Genetic testing is most likely to reveal a mutation in which of the following genes? I have never seen any of these before in my life.
Okay.
Okay, I'll do my best.
Yep. That's
Um,
all we can ask for.
a 7-year-old boy is brought to the pediatrician by his parents due to multiple episodes of fainting during the past few months. His parents mention that he has been complaining of dizziness and they have noticed that he seems to have difficulty hearing. An ECG reveals a prolonged QT interval. The patient's family history is significant for consanguinity, and younger sibling also has experienced similar symptoms. Okay.
Be a diagnosis. If you don't know the genes, do you know the diagnosis?
I I don't. My best guess would be like, I mean, you have hearing issues, you have dizziness. My best right now is thinking Meniere's disease, but there's also no tinnitus, and I've never heard of Meniere's disease to deal with prolonged QT interval.
Okay, so
I
unlikely
have no other
Meniere's.
disease idea besides that.
Okay, gotcha. So this is a very specific disease, right? Jervell-Nelson's disease. Okay. I'm not sure if you remember that. Prolonged
I've never,
QT,
no, I don't know that at
loss
all.
of, yeah, prolonged QT. So you can get arrhythmias. So these patients, you got to be careful for their arrhythmias because you can die because of arrhythmias and they'll have some hearing loss too. And then, of course, you got to pick a gene, which this is where my knowledge stops because I can't remember the gene. I want to say, right? I want to say it's C, right? That's kind of what I remember in the back of my mind. But I'm not 100% sure. But this would be my gut. So let's kind of see and kind of go from there. See, look, my gut's pretty good.
Nice, good
All right.
stuff.
So Jervell-Nelson syndrome, right? Is kind of what I was telling you about. This is something that they do test you on step one. And also, ironically speaking, this is on my boards too, which is why I know it pretty well. I just couldn't remember the gene. I just remember it looks something like this, but I can't remember exactly the letters. So it's a potassium channel subunit. Okay, just remember that. They will ask you that on step one, and they asked me on that for ENT boards also. It's a potassium channel that's messed up, which is why there's a heart defect, but you're going to get kind of sensory hearing loss and then arrhythmias. So very
Yeah, I have
specific.
never heard of that ever. So I'm glad
Yeah.
that at least I know that now.
Yeah, it is in first aid. It's like literally like I think 3 sentences in first aid. So it is in there. I can't remember if it's in the cardio section or where it's in, but it is in there somewhere. So
Okay.
all right.